Let me start with a disclaimer that I do not have any affiliations with any pharmaceutical companies or manufacturers or any entities. This presentation reflects my own thoughts and experience, and it's only for educational purposes. We will have a quick introduction about HIV, and then we will talk about the pre- and post-exposure prophylaxis. And we will talk about the future directions in Canada and the role of pharmacists and specialty pharmacy. As you know, that human immunodeficiency virus is a sexually transmitted infection and also bloodborne that is transmitted through sexual interaction and vaginal fluids, rectal fluids, and also from human milk from one person to another, and also can be transmitted through a pregnancy. There are two types of HIV, HIV-1, which is more prevalent, about 90% of patients living with HIV-1, and the HIV-2, which is characterized by low transmissibility, and it's very hard to develop to AIDS, while AIDS is the acquired immunodeficiency syndrome, and it's the long term of HIV infection. At the beginning of the epidemic, there were like 88.4 million people living with HIV, and 42.3% of people died with HIV. But globally, at the end of 2023, now it's 39.9 million people living with HIV, with 0.6% at the age of 15 to 45 of adults living with HIV. So this is a huge improvement in the prevention. And as you know, that HIV has lots of drug classes and various drugs and treatments. This is one of the most common HIV drugs available in Canada for adults. It's like a table here available through the link below. And let me start with PrEP. What's PrEP? So PrEP is the pre-exposure prophylaxis, which include a combination of medications that can be taken by people who are at high risk. And it should be taken with individuals by individuals who are HIV negative. And when it's taken as prescribed, it shows effectiveness and a prevention of HIV transmission by more than 90%. Again, it has to be taken by individuals at high risk. For example, people who have sexually activity with HIV positive person, or with an individual whose HIV status is unknown, people who share drugs, or people who have diagnosis of sexually transmitted diseases. And also it is considered for people who are on post-exposure prophylaxis and are still at ongoing high risk of infection. PrEP treatments, there are two treatments now. First, the oral treatments. There are two oral tablets available in Canada. The first one, M-tricytabine with tenofovir disoxyproxyl fumarate, 300 over 200 milligrams, and it's taken daily. And the other one is M-tricytabine tenofovir alafenamide, also 300 over 200 milligrams. These are combination of two nucleoside reverse transcriptase inhibitors, which inhibit one of the enzymes that help the HIV to convert the RNA into a DNA inside the human body. And these two medications are very tolerable. The only side effect is a startup syndrome, which is nausea, some flatulence or vomiting, which subside by time over 1 month of starting the treatment. The great news is that long-acting intramuscular injection has been recently approved by Health Canada, exactly on May 10, 2024. And this shows a huge promise in preventing HIV because it's an alternative to oral tablets and it helps patients to comply to medication. It's recommended for adults and adolescents for more than 35 kilograms. And it consists of 3 phases. The first phase is the cabotegravir. It is cabotegravir intramuscular injection, but there is an oral lead. The doctor may prescribe cabotegravir tablets once daily for 28 days. It's according to the doctor's discretion and the patient preference, just to test tolerability. If the doctor or the patient decided not to take the oral lead and go through the injections right away, that's totally fine. So the initiation injections are 1 injection to be taken monthly for 2 months, and then patients start the maintenance dose, which is 1 injection every 2 months. And the side effects are injection site reaction, and we also talk to the patient about any mood changes or depression. There are some off-label and investigative PrEP therapy that are still under studies. We have the on-demand PrEP, which is an alternative to the oral daily PrEP. So it is recommended to take 2 tablets of M-tricytabine, tenofovir, diazoxyproxyl fumarate, 2 to 24 hours before the exposure to HIV, and followed by 1 pill daily for 48 hours. It's called 2-1-1 therapy, but still not approved by Health Canada, and it has demonstrated reduced transmission by, especially in male having sex with men, by 86%. Still, there are some medications that are under investigation, like the twice-yearly lenacapavir subcutaneous injections, dapivirine intravaginal ring, islatravir monthly oral capsules, and a subdermal implant. Still, there are ongoing clinical studies for efficacy, safety, and feasibility. The follow-up is very important, so it is recommended that we have to test for HIV antigen antibody at month 3 of starting the PrEP, and also bacterial sexually transmitted infections for everyone at the 3 months. That's why if we have, as a pharmacist, if I have a prescription for PrEP for more than 30 days, for more than 90 days, it's not recommended because patients needs to be seen at 3 months. At 6 months, we have to assess renal functions for people above 50 years old, or or people who have creatinine clearance of less than 50 and 19 mL per minute, and also bacterial sexually transmitted infections should be tested for all patients. And then every 12 months, which is every year, renal assess should be done for all patients, as well as chlamydia screening for bacterial sexually transmitted infections. And also we have to assess weight, triglyceride, and cholesterol levels. It depends on the medication. When to discontinue PrEP, it's still unknown, but we know that after discontinuation of PrEP, the antiviral protection decreases over 7 to 10 days. And when to test for HIV after discontinuing PrEP, still it's unknown, but according to the studies, at week 8 of discontinuation, seems like it's reasonable. Okay, what is the post-exposure prophylaxis? So after exposure to a risk of acquiring HIV, there are antiretroviral therapies that can be taken by negative individuals after a moderate or high risk of exposure. Post-exposure prophylaxis should be started within 72 hours of the exposure, and it involves intraviral medications that has to be taken daily for 4 weeks. Who should be considered for PEP? There are 2 types of exposure for PEP. So the first one is occupational exposure, which is like the healthcare setting, and the non-occupational exposure, which is like condom-less sex with HIV positive partner, or who's not under treatment, or HIV copies of more than 200 copies per month. Those are the recommended regimens. So the first one is tenofovir diazoxyproxyl fumarate in tricytabine 300/200, and raltegravir 400 milligram to be taken twice daily for 28 days. This regimen has proven great efficacy and with minimal side effects and drug-drug interactions, but the only main withdrawal is that it's taken twice daily, so people do not prefer to take twice daily tablets. The second regimen is tenofovir diazoxyproxyl fumarate and M-tricytabine along with dolutegravir 50 milligram daily. It is one of the most recommended regimens, but dolutegravir has some side effects that patients cannot tolerate. And the third one is tenofovir diazoxyproxyl fumarate and tricytabine along with darunavir 800 milligram and ritonavir 100 milligram daily. It has shown great efficacy, but has high number of drug-drug interactions and a high number of side effects. And again, selection of PEP it depends on the patient's situation. So it depends on patient preference, number of tablets, comorbidities, if patient has any underlying condition like Hep B co-infection, and there is no evidence to for any superiorities or any more recommended 2 drug regimen over 3, nothing has been proved. This is a summary of pre and post exposure prophylaxis regarding the population, medication use, duration, common side effects, and follow-ups that we talked about previously. And let's talk about the future direction in Canada. So there is expansion of pre-exposure prophylaxis, and this is by continuous education and removing stigma. And Canada is trying to have access to PrEP through public health organizations and community-based clinics. Long-acting injectable has been approved, which shows a great promise for PrEP, and now it's covered by it will be covered soon by lots of insurers. And the post-exposure prophylaxis accessibility, it's very important to spread the awareness about the importance of checking for post-exposure prophylaxis within 72 hours after the exposure. And also there are great efforts to have access through emergency departments, pharmacies, and telehealth services. Also, there is a focus on the vulnerable populations like the indigenous. There is a great effort to make like the pre and post exposure prophylaxis a part of the sexual healthcare service, and we have lots of healthcare professionals that has to go like training on how to prescribe those kind of medications. And for the public health campaigns and education, there is a continuous support for education and removing stigma and spreading awareness through social media and digital platforms. And for the policy and funding, there is always a change in the funds to help people access the medications for pre and post exposure prophylaxis and to provide equitable access. All these efforts, Canada border goal to eliminate HIV as a public health threat by 2023, which aligns with the global aim. What is the pharmacist role? So as a pharmacist, we play an important role. We have to know how or when we should recommend for HIV testing. We have to know the signs and symptoms of the disease and when the behavior makes it a risk for the patient. For the treatment of the HIV, we also have to interpret some blood work that may affect the choice or the regimen of the patient. Like if the patient has Hep A, B, or C, if the patient has high cholesterol. So this affects the choice of the medications. And we provide counseling and we have to educate the patient about the medication, about the disease, what to watch for, how to manage their side effects, when to test, and how to follow up with their doctors. Also, we play a role in the treatment failure. If patient is having some toxicities and cannot tolerate the medication, we have to refer back to the doctor and the doctor has to interfere. And we have to also know when to, regarding the social services and HIV infection, we have to know when to apply for patient support programs and help them get prior authorization and so on. And for the follow-up, we always follow up with the patient, make sure that they adhere to their medication, if they have any financial problem, if they have any adverse effect. And there is always help. We have some hotlines that we can provide to the patient that will help them anytime. And there is now a great role for specialty pharmacies. So let me talk to you about our mission and focus. In specialty pharmacy, we dispense special medications for complex and rare diseases that need special handling, special administration, special education to the patient. And we have patient support programs which help the patient counseling, we have patient education, follow-ups, and also sometimes they provide financial assistance. Coordination of care in the pharmacy. As pharmacists, we work closely with all healthcare professionals, insurers, and patients to make sure that the patient accesses their medications on the right time. Bayshore Specialty Pharmacy is a part of Bayshore Healthcare. We have over 80 community care homes and over 100 community clinics and 11 pharmacies over Canada. So we delivered medication to either the patient's home or to the clinic, depends on what kind of medication. For example, for the intramuscular injections, the long-acting medication, we deliver to the clinic. So we make sure that the patient is scheduled and we receive a prior injection authorization that the patient was here, he took his medication. So this helps us track the patient and make sure that the patient is adhering to the medication, no side effects. And we do some AEs, we report all the side effects to both manufacturer and Health Canada. And continuous education, Bayshore help us to continue for continuous education about the most updated treatments and the sensitivity of patients' confidentiality to all patients, especially to HIV. So in my opinion, specialty pharmacies play an important role in preventing HIV. Thank you, that's all.